Hello, friends. Welcome to UK Dreamers. Welcome to another wonderful session with a very special guest today, Ms.Rachel Dexter, who will enlighten us about the gaps that we have in our communication when we come to the UK. As healthcare professionals, we all do the English exams, but when we actually land up in the UK, it's a different world. So welcome, Rachel. Welcome. Thank you so much for joining us.
Pleasure. Thank you for having me.
Thank you. Thank you. Kindly tell a little about yourself, Rachel.
Yeah, absolutely. So, my name is Rachel. I'm from the UK, although I currently live in Denmark. I have done for the last 4 years. My background is working in the NHS. So I worked for 12 and a half years as an occupational therapist. So I've got a kind of background working in both hospitals and in community. And practiced as well for a period of time in Africa, so kind of had that experience, cross-cultural practice. But when I moved to Denmark for kind of 4 years ago now, I started going through a process of, well, what do I do? You know, do I try to learn Danish to a high enough standard to practice in the Danish health system? And would that prepare me for practicing in a different system? And that's kind of the journey that got me thinking about, well, what must it be like for doctors and healthcare professionals coming to the UK? And I think as well, stepping outside my own culture and living in another culture and having friends from all around the world, you realise actually how confusing British people can be and how we communicate. Lots of kind of funny misunderstandings amongst friends. And that again got me thinking, well, you know, if you're practicing as a healthcare professional and you come across these kind of, you know, British nature to our communication and the things that we say that aren't very clear or the ways that we do things, you know, how do people cope with that? And I started reaching out to international doctors and very, very quickly realized that it was a huge need and a huge problem that nobody seemed to be addressing. So that's when Healthy English started. That's when I founded Healthy English, and the rest is history, really.
That's great. That's great. I would say, Rachel, this is actually a subject that most of the international medical fraternity is totally unaware of. We don't think that it's actually required. What's the importance of it? And like, even if we have the doubts or the confusions, we don't know whom should we approach like.
Yeah.
Yeah,
exactly.
Yeah, so guys, we'll be talking about, we'll give few references of my experience where I've done blunders. And we'll take few experience of Rachel's where we can, you know, bridge those communication gaps and make a healthy as Rachel's vlog is all about healthy English. Use the healthy English and make it better for our patients and, you know, overall the benefit for everyone.
Yeah.
Okay, so Rachel, if you don't mind, I'll discuss the opening scenario with my blunders statements, which I use in the NHS when I started working last year. So I was seeing this 80-ish old elderly lady who came with a problem of having a melena, passing blood to the back, from the rectum area. So I took my nurse as my chaperone, and we went and I explained the patient that you're having this, and I'll have to examine your rectum basically. And then she looked me. I said, I want to examine your anal canal, and that was even more offensive something. So now my nurse on the side of me is giving me her elbow and like, doc, what are you saying? And I'm like, yeah, we do a rectal exam. And then she says me, doc, can you come outside? So I just went outside, and she said, doc, you can't use those words. I said, why can't I? Like she knows her body parts. I'm trying to examine it. A rectal exam. And then she's like, no, doc, you have to say back passage. That's back passage. Then the first time it really made a big difference, because when I came back to the room and I'm explaining this lady that, okay, you're having bleeding and we'll have to examine your back passage. And suddenly her approach towards me went from the blank and confused one to a little, confident. Okay, this doctor is knowing what he's actually up to, what he wants to do. So that made me realize, this is something that's missing in my clinical skill. Though I've done the English exam, but this has nothing to do with the English exam that I've actually done.
Absolutely. Yeah, sorry, you were going to carry on.
And that's what I think is, missing with most of the
Yeah.
healthcare professionals. But
Yeah.
we don't know if it's actually wrong with us. There's no one to correct us on that perspective.
Yeah, I think you're absolutely right. There's a huge gap, and it's not your fault, right? That I just want to make that clear. It's not. It's not your fault. It's not something that you should have done or prepared for. Um, so, so yeah, you're absolutely right. This is what often happens is that, as a doctor, you've gone through all these stages to practice in the UK, and you've passed all the English exams and the communication exams, and you think, okay, I'm ready. And yet nothing really prepares you for communicating in a completely different system, a different culture where people have a different communication style. But not only that, like you mentioned, there's this huge kind of cultural use of English. So people do not use a lot of the terms that you might be used to communicating in English. They just don't use these more technical terms. They have lots of slang terms they'll use for body parts. They'll have lots of terms. For example, in your example, British people are very reserved, right? So they don't like to talk about private things. They get all embarrassed. So they probably don't want to associate with those kind of more technical terms for their body parts, or have these slang terms that they feel more comfortable using. And that's kind of just one small example of this wide kind of cultural use of the language, the colloquialisms, the expressions, the idioms that in their literal sense don't mean the literal sense. They mean something completely different. We take words completely out of different contexts and we mean other things. And there's no way that you can understand that until, if you've not grown up in British culture, you've not grown up with the language. So, there are lots of terms, lots of expressions that patients will use, lots of slang terms that colleagues will use. I'll give you one example of my own. Okay, so I spoke with a doctor who was seeing an elderly lady on the ward who said, "Oh, I need to go and spend a penny." And she was like, "Spend a penny? What's she talking? Maybe she wants some food from Marks and Spencer's in the hospital." So she's getting one of the nurses, "Could you go down and buy her something? She wants something from the shop." Another doctor, same expression, thought, "Oh gosh, I think this patient's maybe a bit confused. They've got maybe like some cognitive issues here. She's asking me to spend a penny. I'm in the hospital." And do have you heard that one? Spend a penny. Yeah. So it's to go to the toilet, right? So it's to have a wee, which elderly people often use. It roots back from when you have to spend a penny to use the public toilets. So again, one example, there are so many, and it's a whole part of the language. So people kind of feel like they start to practice and they've got to learn a whole new language to communicate. And then on top of that, throw in regional accents and regional dialects. So you have particular parts of the UK where words and expressions are used, but nowhere else in the UK. Yeah, so I grew up in London, moved to Sheffield. I practiced in Rotherham. I had to learn new language, okay, as a British person, because there are regional expressions and regional dialects as well that people have to adjust to. So it can be a huge challenge.
Absolutely, because initially when I used to ask the patients, do you want to use the urinal? Do you want to urine? Like, you have any trouble passing urine? So the urine word per se in India, we didn't mind using that because it's we feel it's a medical technical sort of conversation with the patient, but they were not comfortable with it. And when it was really funny because my daughter started going to the school. And she was also not knowing much of the British English. She was just very, very basic, very, very crackly sort of English. So one day she comes back and she's like, "Papa, I want to wee." And suddenly I said, "I've heard this term somewhere." Then I realized, okay, the patient was saying, "Doctor, I want to wee." Then I said, "Oh, this is where it's correlating." So the next day I went to the department. I was seeing this patient, and that's what I changed. So previously I used to ask them, "Do you have any trouble passing urine?" Now I say, "You have trouble doing wee?" And then was a big difference maker. Like we don't use the term urine here, we use water. So that
Yes.
was confusing. I've given my
Yeah.
water sample to that place, and I'm like, why would someone give?
Water. What? Or they say my waterworks. I'm having trouble with my waterworks. I'm having trouble with my bladder. Yeah, it's very, very funny. And there's probably, well, there's so many different slang terms as well for body parts. Because people don't, and different ones that are used for children, and if you don't know them, it's like, well, what on earth are they talking about?
As you said, the regional differences. So like I stay in West Midlands. So
Yeah.
the Black Country accent, as you're aware, is one of the most
Yes.
hardest ones. So
Yeah.
one day, a patient came to me, and he came in because he had a collapse, as I could read on the his sheet, and he's like, "Doctor, I keeled over," and I'm like,
Yeah.
"Oh,
What?
over." And then I called one of my nurses who was from Philippines, and she's like, "Do you know what this gentleman is saying?" And she's like, "No, no, no." And now I'm literally thinking to scan his head because he's speaking something.
Yeah, keeled over. That's another good example. Yeah, when you faint or pass out. Yeah, and again, I remember a conversation with one of with one of the doctors I was working with, and the patient had said, "Oh, I feel like I'm going to pass out." Okay, so pass out, another expression for losing consciousness, for fainting or blacking out. And he thought, oh my goodness, he thought it was the same as passed away, I feel like I'm going to die. Yeah. So the doctor's like, oh my goodness, are you starting getting, really, really concerned, thinking this patient thinks he's going to die. And he was just saying he felt faint. So yeah, it can cause so much confusion. And there's I'll give you another example, which has more serious consequences. So a lot of doctors that I communicate with in their country, where they come from, they would use the term miscarriage and abortion to mean the same thing. Now, in the UK, very different. Miscarriage is when you lose the unborn child. That was not a choice. It's a tragedy that's happened, and parents are very, very traumatized by that. Abortion is the deliberate decision to terminate the pregnancy. So two very different meanings in the UK. And I've known doctors who have come from their own cultures where they're used indeterminately. So they're not differentiated. And so they have spoken to a mother who's had a miscarriage and called it an abortion. Now, that mother obviously then has got extremely upset and then put a complaint in. Now, there's no way that doctor could have known that in the UK there's that difference, but it had a huge implication on that relationship. So it's these kind of things that can cause real difficulty.
Of course. So Rachel, the problems are enormous, I would say. There's no limit to the problems. So what's the solution to this? What solution do you think you offer, and how every doctor or every healthcare professional who's coming to this great country to practice medicine should be, getting it as a basic sort of, welcome, or a induction sort of thing?
Yeah, absolutely. I mean, I think it needs to be addressed. I think my hope for the future is that there's a kind of standardized support and standardized training for IMGs that is offered, because I think at the minute it really varies from trust to trust, from what I gather. But then there needs to be support in this area. From what I've seen, and I've been doing this since early 2019 now, that it does seem to be that there's this huge gap. So there's lots of training around the system and how the NHS works, and there's training, the English language training. So yeah, I think so I think the first part is awareness and understanding, because often people focus on, okay, they're struggling with communication. So they think, right, I need to improve the technical aspects of the English language, my vocabulary, my grammar, and then I'll improve. But that's not the answer. So I think the first part is actually recognizing and having the awareness of where the support is needed, where the issues are. So some of the things that I've been doing to support IMGs, one is my monthly course. So my course is called Encouraging, Equipping, Empowering UK IMGs. It runs every month, starting on the 1st, over 20 days. And what we do is there's 10 kind of pre-recorded training videos you can watch around your own schedule. And I do live Q&As and discussion sessions as well. But it breaks down kind of communication, but it looks a lot about the cultural implications of the British communication style, how British people communicate, because we're not direct. Yeah, we don't communicate clearly. We are indirect. We make understatements. We don't always say what we mean. So when you come from a culture where you communicate in a very direct way, you just assume that people are telling you what they're verbally telling you. But we have to pay a lot of attention to the nonverbal communication. We have to understand what British patients expect, what they value. So it goes all into detail about kind of understanding what it means from a cultural point of view, practicing as a doctor in the UK, and then building these communication strategies to be able to build good relationships with British patients, good relationships with British colleagues, because a lot of doctors also feel isolated socially from their colleagues. You know, they're very competent with the professional conversations, but when it comes to chatting in the staff room about social stuff, they really struggle. So it goes through all of those, understanding British humour as well, everything that you need to kind of get prepared to thrive really in your job in the UK and to be prepared. So that's one of the things. And then something else that I offer is it's called the IMG Toolkit. And there's 10 resources in there, including resources all about the colloquialisms and the slang terms and what they mean and how they'll be used in example sentences, whole section on NHS abbreviations, whole section. So it goes through kind of all the tools that I think are kind of missing to help prepare IMGs. So that's a couple of things that Healthy English is doing.
So guys, my recommendation, if you're starting to work in the UK, please go to Rachel, get some basics and avoid the embarrassment that you're going to get. I had a lot of, I would say, embarrassing sessions. And, at the end, you feel like, oh, man, that's a cherry on the top, basically, because you're already, trying to get into the so much what is the transition, as I say. So the transition, if you want to make it smooth, I would definitely recommend, please go to a communication teacher who can teach you how things work here in the UK, so that, you sail smooth and there's no much hiccup on your part. I'll give the details of Rachel's, the channels and her Facebook links and everything in the description. If you want to contact Rachel directly, you can leave the comments as well. So Rachel, before we conclude this session, what's your take-home pearls for the IMGs who want to come to the UK?
My take, okay, so what I would say is, we need you. The UK needs you. You have fantastic skills, fantastic knowledge, and we are so appreciative of IMGs who do make that transition, because the NHS wouldn't survive without your wonderful input. So, but just be prepared that, it can be challenging, and the more that you can do to prepare yourself, the easier it is. And I've worked with doctors all the way from before they work in the UK all the way up to being in the UK for 17 years. So you don't want to have to wait that long. You don't have to have to make the mistakes to learn from the mistakes. Get prepared straight away, and then you can transition really strongly, and you can thrive in your career.
Thank you so much, Rachel. So guys, keep liking the videos, keep sharing it. And if you need any further guidance regarding the communications, you can contact Ms.Rachel Dexter. And thank you so much, Rachel. Thank you so much for giving. Thank you, guys.
Thank you, guys. See you. Bye.